According to a startling report from the American Cardiovascular Health Institute, every 40 seconds in the United States, someone's life is threatened by a heart attack. That's an alarming statistic, isn't it? But here's something even more shocking, something that might challenge everything you thought you knew about this dangerous condition. The vast majority of heart attacks don't announce themselves with the dramatic, chest-clutching pain we so often see in movies. Instead, this enemy, known medically as a myocardial infarction, often attacks silently, hiding behind heart attack symptoms that seem deceptively minor. Those elusive, silent heart attack signs that you, or even your loved ones, might be experiencing daily and easily dismissing as just another trivial discomfort of aging. That unusual fatigue you've been blaming on getting older? That persistent indigestion? Or that vague discomfort in your shoulder or jaw you thought was just a common ache? Are these anonymous fears, this unease of not knowing if those signals are a dire warning from your weakening heart, keeping you up at night? Do you dread the thought of not recognizing a heart attack in time for yourself or for your spouse, your cherished family members, and then facing unimaginable regret? If these words resonate deep within you, then please stay right where you are, because in the next few minutes, this video will be the golden key to unlocking all those mysteries. Together, we will peel back every layer of a heart attack's disguise, from the most obvious symptoms to the most subtle signs. You won't just learn to identify them, you will understand why these symptoms occur, and, most critically, what you must do immediately when they strike. This isn't just another informational video. This is your guide, your intellectual weapon to reclaim control, to confront and conquer the fear of a heart attack. Let's embark on this journey together, because your health and peace of mind are worth protecting. In our previous segment, we touched upon the often misunderstood nature of a heart attack. Now, we'll delve deeper into how its presentation can be surprisingly different, especially in women, our respected elders, and sometimes with no obvious warning at all. Understanding these nuances isn't just interesting, it's a crucial step in protecting ourselves and those we care about. It's a truth that the medical community has increasingly emphasized. Heart attack symptoms in women can be a world away from the classic dramatic scenarios. For instance, studies from the American Heart Association indicate that only X% of women report chest pain as their primary symptom during a heart attack. This critical difference means that symptoms are often tragically misdiagnosed or dismissed. So what should women be particularly vigilant for, beyond or even instead of acute chest pain? These can include unusual or profound fatigue, sometimes lasting for days, or a sudden, overwhelming exhaustion. Sleep disturbances and unexplained anxiety are also noteworthy. Shortness of breath, which can occur with or without chest discomfort, is another sign, as are nausea, vomiting, or a feeling of fullness easily mistaken for a stomach issue. Furthermore, pain in the upper back, often between the shoulder blades, one or both arms, shoulders, neck, or jaw can be indicative. These differences may stem from hormonal factors, variations in heart and vessel size, or how nerves perceive pain. The vital message is to trust your body. If something feels distinctly off, it warrants immediate attention. As we gracefully age, our bodies communicate in different ways, and for older adults, a heart attack might not present with that crushing chest pain. Symptoms may be less prominent. Instead, sudden and unexplained weakness or tiredness may be the main signal. Dizziness, lightheadedness, or even a fainting spell, along with the sudden onset of confusion or an abrupt change in mental state, can also be warning signs. A gradual, or sometimes sudden, increase in shortness of breath during usual activities is another indicator to watch for. It's easy to attribute these to just getting older, but new, unexplained symptoms always deserve a prompt discussion with your doctor. Perhaps the most deceptive form is the silent heart attack. The Centers for Disease Control and Prevention estimates that nearly 500,000 Americans have a silent heart attack each year. This means heart damage occurs without clear, unmistakable heart attack symptoms, or the symptoms of a silent heart attack are very mild. Individuals with diabetes are particularly vulnerable, as nerve damage can blunt pain perception. The signs of silent heart attack can be incredibly vague, such as mild chest discomfort, unexplained persistent fatigue, lingering indigestion, or a flu-like feeling you can't shake. Because these symptoms are so understated, the danger is that damage goes unnoticed, making regular checkups and open dialogue with your healthcare provider about any persistent, unusual feelings truly vital. Now that we've explored the varied and sometimes subtle ways a heart attack can present itself, it's equally important to understand what's happening within the body to cause such a critical event. A heart attack, or myocardial infarction as it's known medically, occurs when the flow of oxygen-rich blood to a part of your heart muscle is suddenly and severely reduced or blocked. When your heart muscle doesn't receive the oxygen it needs to survive, it begins to sustain damage. The primary culprit behind most heart attacks is a condition called coronary artery disease. This disease is characterized by a process known as atherosclerosis. Think of atherosclerosis as a gradual buildup of fatty deposits, cholesterol, and other substances, which collectively form what we call plaque on the inner walls of your coronary arteries. These arteries are the vital pipelines supplying oxygenated blood to your heart. Over time, this plaque can harden and narrow the arteries, a specific condition known as coronary atherosclerosis. The real crisis often begins when one of these plaques ruptures or cracks. When that happens, a blood clot can quickly form around the ruptured plaque, and this clot can grow large enough to completely block the artery, cutting off blood flow to the portion of heart muscle it supplies. While coronary artery disease and atherosclerosis are the most common causes, a less frequent trigger for a heart attack can be a severe spasm or sudden contraction of a coronary artery, which can also stop blood flow to the heart muscle. It's also useful to quickly distinguish a heart attack from heart failure, as these terms are sometimes confused. A heart attack is primarily a circulation problem, a blockage stopping blood flow to the heart muscle. Heart failure, on the other hand, is generally a pumping problem, where the heart muscle isn't able to pump blood effectively out to the rest of the body. However, it's important to know that an untreated heart attack can indeed lead to heart failure. Understanding these root causes of heart disease empowers us not to fear, but to appreciate the importance of proactive heart health, a topic we'll explore further. Having understood the underlying causes of a heart attack, let's now turn our attention to recognizing its more common alarms, the heart attack symptoms that often signal this critical event. While, as we've discussed, symptoms can vary widely, there are several hallmark signs that everyone should be aware of. The most frequently discussed symptom is, of course, chest pain or discomfort. But it's crucial to understand that this isn't always the sharp, sudden pain many imagine. For many, it's a sensation of pressure, squeezing, fullness, or a heavy weight in the center of the chest, famously described as feeling like an elephant is sitting on your chest. This discomfort might last for more than a few minutes, or it may come and go, sometimes referred to as stuttering chest pain. It's not typically a fleeting, sharp jab, it's more often a persistent presence. This discomfort can also radiate or spread from your chest to other areas of the upper body. You might feel it in one or both arms, often the left, your jaw, neck, back, or even your stomach or shoulder area. You might wonder, what is a heart attack like when pain spreads like this? This happens because the nerves from the heart and these other body parts send signals along shared pathways to the brain, and the brain can sometimes get confused about the pain's exact origin. It's a fascinating, though concerning, aspect of how our bodies signal distress. Beyond chest discomfort, several other symptoms of heart attack often accompany this event. Shortness of breath is very common. You might feel like you just can't get enough air, even if you're resting. Breaking out in an unexplained cold sweat, or diaphoresis, is another significant sign. Nausea or vomiting can also occur, sometimes accompanied by a feeling of lightheadedness or dizziness. Your heart might also feel like it's racing or beating irregularly. It's so important to remember, however, that not everyone will experience all these symptoms during a heart attack, and their intensity can vary greatly from person to person. Some may have only mild discomfort, while others experience severe symptoms. This variability is why understanding the full spectrum of signs is so vital. One of the most dangerous points of confusion when it comes to heart attack symptoms is mistaking them for simple heartburn. This misinterpretation can tragically delay life-saving medical attention. While both can cause chest pain, there are key differences to help distinguish a heart attack versus heartburn. Typically, the discomfort from a heart attack is felt as a pressure, tightness, squeezing, or heaviness, often in the center or left side of the chest, and it may spread to your arms, jaw, neck, or back. This heart attack pain usually lasts more than a few minutes, might come and go, and isn't typically relieved by rest or antacids. It's often accompanied by other symptoms like shortness of breath, sweating, nausea, or lightheadedness. In contrast, heartburn pain usually feels like a burning or gnawing sensation, often starting in the upper abdomen and possibly moving up into the chest or throat. It's frequently worsened by eating, lying down, or bending over, and can often be relieved by antacids or changing positions. However, because symptoms can overlap and present differently in individuals, the most important advice we can offer is this. If you are ever unsure whether your chest pain or discomfort is a heart attack or something less serious, always err on the side of caution. Treat it as a potential heart attack and seek immediate medical help. It's far better to have a false alarm than to risk delaying critical care. Recognizing the varied symptoms of heart attack is the first critical step, but what you do next and how quickly you do it can make all the difference. When it comes to a heart attack, there's a vital saying in medicine: time is muscle. Every minute that blood flow to the heart is blocked, more heart muscle can be damaged. Acting fast isn't just important, it's potentially life-saving. So, if you are recognizing a heart attack in yourself or someone else, here are the immediate, crucial steps to take. First, and most importantly, call 911 or your local emergency number right away. Do not attempt to drive yourself or the person to the hospital. Emergency medical services can begin treatment en route and are the fastest way to get to the appropriate medical facility. While waiting for help to arrive, the person should stop all activity immediately and sit or lie down in the most comfortable position to reduce strain on the heart. If they take nitroglycerin for a known heart condition, help them use it as prescribed by their doctor. Taking an aspirin, if not allergic and if advised by a doctor for such a situation, can also be beneficial as it helps to thin the blood. However, this should only be done if there are no contraindications and it aligns with prior medical advice. Try to stay calm and gather any information about their symptoms, when they started, and any relevant medical history or medications they take to share with the emergency responders. To ease some anxiety about what happens next, once at the hospital, doctors will work quickly to diagnose the heart attack. This often involves an electrocardiogram or ECG to measure the heart's electrical activity and blood tests to check for heart muscle damage. If a blockage is confirmed, cardiologists can often perform procedures like an angioplasty, where a balloon is used to reopen the blocked artery, sometimes followed by placing a stent to keep it open, restoring vital blood flow to the heart. Remember, swift action opens the door to these effective treatments. Understanding how to act in an emergency is vital, but equally important is recognizing the subtle whispers your body might send before a crisis and taking steps to prevent a heart attack in the first place. Many heart attacks don't occur out of the blue. They often have warning signs, heart attack, that can appear hours, days, or even weeks in advance. One of the most common early indicators is recurring chest pain or pressure, also known as angina, which typically occurs with exertion and subsides with rest. This is often a sign of underlying coronary artery disease. Other early warnings can include a gradual increase in unexplained fatigue or becoming more easily short of breath with your usual activities. We encourage you to keep a simple symptom diary if you notice any new, recurring, or unusual feelings to discuss with your doctor. Proactive prevention is truly your best defense against heart disease and atherosclerosis. Key risk factors to be mindful of include high blood pressure, high cholesterol, diabetes, smoking, obesity, a sedentary lifestyle, and a family history of heart conditions. The good news is that many of these can be managed. Embracing a heart-healthy lifestyle is paramount. This includes a diet low in sugar and saturated fats and rich in fiber from vegetables, fruits, and whole grains. Choosing lean proteins like fish and chicken over red meat, and incorporating healthy nuts like walnuts and almonds. Regular physical activity, combining both aerobic exercise and some strength training a few times a week, is also incredibly beneficial, as is maintaining a healthy weight and, crucially, avoiding tobacco use. For those who have already experienced a heart attack, these lifestyle changes, along with strictly adhering to your doctor's treatment plan and attending regular follow-up appointments, are key to preventing a second heart attack. Your doctor might also prescribe medications such as low-dose aspirin to help manage risk. Throughout this video, we've journeyed together to understand the many facets of a heart attack. If you found this information valuable, please consider sharing this video with your friends, family, and anyone who might benefit, especially those who care for older adults. Your share could be the catalyst that helps someone recognize a heart attack in time. Finally, please remember that the information provided in this video is for educational and inspirational purposes only. For medical advice tailored to your individual health condition, especially if you have pre-existing conditions or are taking medication, always consult with your personal physician or a qualified healthcare professional. Thank you for joining us. Please give this video a like if it was helpful, subscribe to our channel for more insights into healthy living, and feel free to share your thoughts or questions in the comments below. Stay informed, stay proactive, and here's to your heart health.